apologise to everyone in advance. This is going to be a bit of a rant, but something has really got my goat. I was listening to the Jeremy Vine show on Radio 2 with Dr. Sarah Jarvis, and they were talking about the use of opioids for pain relief and then huge numbers of people that have got addicted to this. And the stories were coming out of people who'd been on, that had a pain issue. One man had pain in his groin. Once the doctors had established it wasn't a life-threatening condition, then they were just left with pain medication. And these guys were taking hundreds of pills. Some of them were taking 100 pills a day of this medication. I'm surprised they weren't dead from liver failure. But what had happened was that they'd just been put on pain management systems without anyone looking for the underlying cause. Just because it's not a life-threatening condition doesn't mean there's no cause. But the guy with the groin pain could easily have been a twisted pelvis. I've seen that many times. There was a lady who had neck pain. There was another one with fibromyalgia. These are all things that there have been underlying causes for that I've found, and osteopaths have found, and physios have found. I was looking up some data about this, and the European Drug Report in 2015 showed that over 330,000 people in the UK were at risk of being addicts to these drugs. And that number's growing. The number of admissions to hospital due to overdosing of these opioids last year rose to nearly 12,000, and that's doubled over the 10 years. So the use is increasing. The discussion is all about pain management, but nobody is ever discussing what the underlying cause is. We really need to find the underlying cause and get these people off the medication. Now, it can be quite difficult to find the underlying cause, but that's why we do our consultation. Sometimes it's a nerve issue, in which case it's a chiropractic issue. It could be a fixation of the spine. That could be an osteopathic issue. It could be a joint problem, in which case a physio might be the best option, or it can be scar tissue in a muscle, in which case a masseur would be the best person. But 28% of the UK population is estimated to suffer from chronic pain, i.e. pain that's lasted more than 3 months. Now, I can bet you that a fair proportion of those could benefit from some kind of alternative medication, if only the medical profession would point them in our direction.